Hi, this is Tanisha Fuller, and you're watching Black Med, a show where we help you uncover and discover things that affect health issues that affect our community. September is Ovarian Cancer Awareness Month. If you're a woman, this is a segment that you should pay very close attention to. Why? Because ovarian cancer affects our culture greatly. It's a cancer that typically goes undetected. There are no symptoms and there are no early screenings for this disease. It accounts for more deaths with the female reproductive system than any other cancer. Today we're here with Dr. Lilian Jones, OBGYN. How are you today?
Just fine.
So we're hoping today you can help us discover and uncover the myths, detection, screenings, everything about ovarian cancer. So tell me, why is it so hard to detect?
Well, it's hard to detect it because it has very vague symptoms. There's no symptom that's specific to ovarian cancer. Most women will have either bloating or they'll feel full quicker than they usually do. They'll swell, they'll have a little back pain, they might have a change in their bowel habits or something like that. But most of the time, those symptoms are related to something else, and they get attributed to something else. Okay. And that's why it's so hard to pinpoint and have the patients come in when it's early.
Okay. So as soon as a woman detects some changes in her body, would you say that's the best time for her to go in?
Yes, if the changes, she should try to get to know her body. And if the changes persist more than a couple of weeks, she needs to see a doctor.
Okay. Now, what about the woman who goes in annually, gets her Pap Smear, gets everything she's supposed to do? How do those women go undetected?
Well, because many women feel that a Pap Smear will pick up everything. A Pap Smear really only picks up cervical cancer.
Oh, okay.
And so if you ever Google the anatomy of the pelvis, you'll see that it doesn't pick up. It just detects cervical cancer. So on the exam, when you're doing the bimanual exam, all you are trying to determine is, are the ovaries enlarged? And that sometimes can give you a hint. In my career, I picked up 2 just from ovarian enlargement, and the patient after the fact said, oh yes, it was getting tight. It was tight, harder to button my pants and that kind of thing.
Okay.
But it wasn't enough for them to pay attention to. So that in itself lets it to not dismiss those other symptoms. Sometimes they don't mention them to the doctor.
Well, you mentioned earlier we should know our bodies.
Yes.
Pick up on those little signs, a little weight gain. Have you seen that in patients? Does it happen a lot?
Yes, it does. Unfortunately, a good friend of mine's sister had weight gain. We were, in our culture, we were just, oh, finally you're gaining weight, you're looking better, you're doing this and that, because she didn't look unhealthy. She just had been gaining weight and didn't really think anything of it. I don't know how long it had been going on because I wasn't taking care of her, but eventually turns out she had ovarian cancer.
Okay.
Yes.
Okay. What groups of women does ovarian cancer affect the most?
There is no real particular group. African Americans get it a little less than other women, but we go to the doctor later, so it's a little bit more lethal. So many times we tell ourselves that, oh, if ovarian cancer doesn't run in the family, then I'm not at risk. And you really are. You're just at much higher risk if it runs in the family. But yes, if you have breast cancer, colon cancer, uterine cancer, anything like that, and also women who have never had children before are at slightly higher risk. Women who don't breastfeed, women who have never taken birth control pills are at risk.
Wow, never taken birth control.
Exactly. You would think just the opposite. But yes, birth control pills are about the only thing that we've noticed in all this time that decrease the incidence. It cuts it by about 1/3, and nothing else does that.
I never knew that. Tell us, what are some additional risks with ovarian cancer?
The main risks are that it is it's not the family history. There are mainly no other risk factors outside of what I just said with the not having children, not breastfeeding, and that kind of thing.
Okay.
And so that you can't just say, oh, because I don't have ovarian or colon cancer in the family, that I'm not at risk. Nothing could be further from the truth.
Okay.
Yes.
Well, you heard me tell our viewers this is an important segment for them to watch. And so I'm going to be selfish and ask this question. What can I do to reduce my risk?
You can pay attention to your body.
Okay.
If any of those symptoms persist for more than a few weeks, I would go get checked. And many times, if there's any concern at all, if you cannot attribute the symptoms to that, many times the doctor will get an ultrasound and a blood test, a CA-125. That will pick up most ovarian cancers. However, the doctor won't do it if you don't have any symptoms. Nobody has ever seen that those two screening tests were worth getting if you didn't have any symptoms. In fact, most of the studies showed even if you got them every year, the survival was no better than in women who just presented with the symptoms.
Okay. Let's recap some of those symptoms, Dr. Jones. You talked about weight gain, back pain. What are some other things that we can all look for?
Yes. Bloating, a change in bowel or urinary habits, feeling full before you should, before your usual appetite, those kinds of things.
Now that might be a good thing for me. How can ovarian cancer be found early?
That it's tough. It's if the patient presents early enough and it's a non-aggressive cancer, then it'll just make the ovary enlarge and the doctor can feel it on the exam and then order the appropriate tests.
Okay.
Otherwise, only about 20% are found early.
Wow.
They are usually found late.
That's a small number.
That is a very small number.
What is there a time frame with that early detection? The doctor says, okay, this is what we think, this is what we see. Is there a time frame that we need to get back and see you?
No, outside of, if you don't have symptoms, outside of just annual exams. So yes, most of the time that will at least help keep things under control, and you get to know your body, the doctor gets to know many times what we'll do is if there's any question, we'll get a sonogram this year, and if there's any question, either get one in 6 weeks or 6 months, depending on what the findings are.
Okay.
Okay.
What would be the most critical thing you'd want to impart to our viewers today?
The most critical thing is to get to know your body. One of the things I always tell people is even if it runs in the family, even if it doesn't run in the family, if you're over 50, think about it, and you have some other problem. We typically have fibroids. If you have another problem, if you're getting elective surgery, think about getting your tubes removed. If you're over 50, think about getting your ovaries removed.
Okay.
We have a tendency to be afraid of hormones, and we should not be afraid of them if we need them. It's just like if I took thyroid hormones or insulin and I didn't need it, then it's not bad. It's bad if you don't need it. And any medicine has side effects. Any medicine has risks for not taking it. And so we tend to be a little bit afraid of that and not have our ovaries removed. But that only helps in a few instances.
Okay.
So elective surgery, at least consider that.
You have been most helpful. I have to tell you, I was a little nervous about discussing this issue because it's so serious.
It is very serious.
But you've given us great information. You've been watching Black Med. This is Tanisha Fuller, and we've been discussing this with Dr. Lilian Jones. Thanks for watching.